about us. Think about you leaving.
What's going on, everybody? I see Rhonda's in here. Frida, what's up? Roel, what's up? You know what? That's interesting, Roel, about the 15 grams of whey protein. I caught the same thing from that episode today. That was like the thing that really stood out to me to avoid those blood sugar spikes. That was the thing. It was like a 20-something minute podcast, and that was the thing that I left with. It was like, that's interesting. Thank you for checking that out. What Roel on YouTube is referring to is a most recent episode of the Common Sense MD. I'll put it up here in just a second. Esty Bestie over on Instagram. What's going on? You know, I have to give Jasmine Allman a shout out. She did just a fantastic job on the Skid podcast today that went up. It was a demo of the SkinWave and the Dermaplane, and man, it was incredible. The voiceover was so cool. The video work was awesome. Great job, team. I hope you guys will check that out. I'm going to put that up. Loretta, what's up? Great to see you. If you're new with us, we just had a couple people come in. If you're new to the show, let me know. Let me know where you're from. This is the Performance Medicine Show. We answer your health and wellness questions. I'm going to get this up here for Jasmine, our esthetician in the West Knoxville office. She did a demo today that was just fantastic. If you don't know what a SkinWave is in particular, this was a combination SkinWave plus a Dermaplane. But super cool, super helpful in terms of like what that process is like. So thank you, Jasmine, for doing that. Hope you guys get a chance to check it out. Let's see here. My brother Brandon's in here. Brandon, what's going on, man? I hope you're drinking some LMNT. I know you had it was a hot day on the pickleball court. Anybody play some pickleball tonight? It's a hot day out there. My brother Steve's in the building. Steve, what's going on? Good evening to you. Stan, what's up? Bianca, what's up? Robbie and Rachel, what's up? I'm so happy for you guys. I don't know what's public and what's not, but just know that I'm happy for you. I'm so happy for you. Robbie, you're going to be the best. Rachel, you're going to be the best. Edna, what's up? Great to see you. All right, guys, y'all know the drill. We're going to put up questions here shortly. Doc is in the green room getting ready. Let's see. This was the podcast Roel was talking about. Pearls from Synergy Integrated Medical Conference. That's my brother right there, Andy, on your left, I believe. And there's the boss man, Dr. Rogers, on your right. One, I just want to say, like, this is, I love when they do this. I was with them when they recorded. I love when they do that. They literally just got back from an integrative medicine conference. This is those meetings where, you know, kind of the people doing all the research, and you got some really established physicians and thought leaders. And they talk about integrative medicine. There's lectures. It's and then, you know, Doc and Andy get home and they literally just start recording. It was so cool. So thank you guys for doing that. I hope y'all will check it out. It's literally like going to an integrated medicine conference in 20 minutes. Lots of cool things around methylene blue, low dose naltrexone, which we talk a lot about on the show. Oh, awesome. Thank you, Tom. I'm going to put this up here for, I don't know if Carter's here yet, but man, that's so sweet. Thank you. Thank you for putting that in there. They are the best. I'm so glad you had a good experience. Thank you, Tom. My Grandma Mary's in here. Grandma Mary, it's so good to see you Sunday. Looking forward to our date this upcoming weekend. On Dive Into Diet, our latest show, Ways to Cut Calories with nutrition coach Lucas Schmidt. Thank you, Lucas, for doing this. Talks a lot about caloric reduction. I'm glad I pronounced that right. And just different ways that there are to do it. You know, one that you guys are all familiar with that we talk a lot about on the show is intermittent fasting. One way just to eat less. That's what I do. Let's see, Doc, give me a thumbs up when you're ready to roll. I'll get you in here. All right, cool. Tracy, what's up? Anybody new in here? Let me know where you're from. Let me know where you're at. I hope Rachel and Robbie are eating dinner somewhere cool, like Label. What's up, man?
Hey, Ben, how are you?
I am wonderful. You're looking athletic.
I am.
Yeah, you look athletic. Is that like I don't know, did you just get done with a little bit of a
No. As a matter of fact, I just got through eating dinner. I haven't exercised tonight. I'll probably go on a bike ride after this.
Yeah. I might go for a walk myself. It was almost too hot to do it during the day. It was so toasty here in East Tennessee.
No, I love to ride my bike at night, but I do have something on that I'll show you. Anybody guess what that
there
is?
we go. There we go. I love it. I love it. Have you noticed anything yet?
Yeah, that's a continuous glucose monitor, blood sugar monitor. And yeah, it's really interesting. I just put it on today. It lasts for 2 weeks. So I've done it before. This is a new Dexcom 7. So I think it's going to be better than the Freestyle Libre that I wore before. And it's just really interesting to see what happens after you eat, especially. You really need to avoid those spikes. So far, so good. I'm really going to play around with it a little bit and see, what spikes my sugar and what doesn't. So, yeah, Dexcom 7. Actually, Dexcom is going to put out an over-the-counter CGM in August. So that's kind of exciting that you won't even need a prescription for it. And
is that something that you said it lasts 2 weeks? Is that something? So say you get it over the counter, will it? You do it for 2 weeks, then can you do it again, or is it just covered for 2 weeks? Like
you can do as much as you want. It's over the counter. You can do it all you want.
So just keep going.
Yeah, to qualify for some of the CGMs, you need to be a diabetic or for your insurance to cover. But it's just a great tool to learn from and really to tell you what you should be eating and what you shouldn't. But anyway, I'm pumped up again about looking at my results.
I'm gonna put Debbie up here. Debbie's in Australia. Thank you, Debbie, so much
Hey,
for being
Debbie.
here on your Wednesday morning. She's in the CGM family as well.
Oh, awesome.
I'm gonna put this up from Bianca. Do you have any idea what the OTC cost of Dexcom will be?
I talked to the rep yesterday, and she doesn't even know. They're going to meetings out in San Diego later this month, so hopefully we'll have a lot of good information about it and soon. I think you can even pay cash for a Freestyle Libre with a prescription. Maybe the cash price on it's maybe $80 maybe, but I'm hoping it's really affordable, and so everybody will get to know what their blood sugars are doing. It's so important.
Yeah, that's one thing you mentioned, and Roel mentioned it here just shortly around different strategies for avoiding those spikes. And
speaking of
look
Roel,
at that. Yeah.
Thank you, Roel, for that advice. I did get the book.
Roel, you recognize that? You know what? We that's so funny. That was a Father's Day gift, and Roel, we are so appreciative of the idea you gave us last week. I'm pumped for you to get into that. We'll talk more about it. And
me too.
One thing I know Doc is working on personally is his back. So I'm sure you'll have a lot to say about that. I see Montana from our West Knoxville office is here. Montana, what's going on? Great to see you. I see Angie's in here from Kingsport. It's so good to see you, Angie. Thanks for hanging out with us. Okay, we're going to get going to some questions. If you guys have a question for Dr. Rogers, go ahead and put it in the comments. If you're new to the show, let us know where you're at. We'd love to interact with you. And I just like to see new places. I think last week we had the obvious one is Debbie from Queensland, which is amazing. But we've had a few from Virginia recently. Okay, so let's start with this. I got a text from one of my great buddies last week wanting me to ask you this, Doc. It's called Trace Mineral Drops. Are they worth it for someone who eats a well-rounded diet? I'm just going to put this out there. If there's anyone in here live that has had a good experience with Trace Mineral Drops, put it in the comments so we can see what you guys think. What's your thoughts on this?
Yeah, I like them. I have them. I don't take them every day. I take them when I'm after a sauna sometimes, or if I'm really sweating, exercising a lot. But yeah, I think trace minerals are great. Even along with a well-rounded diet, they can benefit you, especially if you're, real athletic and really pumping it out. Or maybe if you're older and, don't have a great supplement to take, like a great multivitamin. But I do like the trace minerals. They're liquid, they get in quick, and I do like them a lot.
I love it. Great question. Thank you for letting us start off that show. Start off the question with that show. I see April's in here. April, what's going on over on Instagram? See, we got some King Sport patients in there over on Instagram. Thank you guys. Let's see. Golly, thank you, Instagram. Y'all are hanging out tonight. I dig that. If you guys got a question, I see you, Ivy. If you guys got a question, put in the comments on Instagram. I'm going to get to every single one over there tonight. This next one, let's see. Let's go to this one right here. Back in March, I was told I am pre-diabetic. Since then, I've been on a rather low-carb diet and trying to lower my A1C and improve my insulin sensitivity. Dropped approximately 30 pounds, but a good bit to go. Today, I got my GI map results and I have a really leaky gut. Can you give me any tips Tuesday on how to do an elimination diet while keeping it really low carb? For context, eating has been a chore last 3 months and now feels almost impossible. So the question is around an elimination diet with a keeping it really low carb. What's your thoughts on this?
So you're pre-diabetic and have leaky gut. First thing I would do is heal the leaky gut. If you do that, everything will get better, including your insulin resistance. And to heal the leaky gut, again, the GI map results, that'll be a good guide. It's a great test to get. You can look at your zonulin levels and see if you indeed have a leaky gut. The first thing I tell people, obviously, is to eliminate the inflammatory foods like sugar, glutens, dairy, corn, soy, maybe nightshades, maybe even oxalates. And, like previously what people think of as healthy foods may not be for some people. Everybody's different with their tolerance. So straighten your gut out first. And, you need a good pre and probiotic, digestive enzymes. Take something like DigestShield. That's my usual go-to. And then depending on how severe it is, you might need to add BPC 157. Colostrum's a good one. Sometimes I use binders. It depends on your bowel habits, whether you're constipated or have loose stools. Sometimes I use fulvic acid as a binder. So it gets kind of complex. It's individualized. The elimination diet, while keeping it low carb, I agree, it's kind of tough. I mean, that's why every diet works and every diet fails. You need to make it a lifestyle. You don't want to make yourself miserable and not be able to stay on it because, you won't do it. So you need to make it a lifestyle change and just eliminate certain things. Like sugars is the worst one. That's another reason to get a CGM, with insulin resistance. So that'll be a really, I'd rather you look at your CGM and a reasonable diet, a reasonable low carb diet, and see what different things do to your sugars, and also while paying attention what happens to your gut. Elimination diets is tough on anybody. If you're going, you don't have to go keto. Not many people can stay on a keto diet the rest of their lives. So you have to kind of make it doable. You're going to have to go low carbs. You're pre-diabetic. So you may want to kind of see what else your gut will stand. And you're just going to have to make a journal, but log your blood sugars. Go out tomorrow and get a CGM. That's going to be the way, that along with just kind of seeing how you feel, how much bloating you have, what your bowel movements are like, how how much reflux you might have. So I think I'd get the CGM, and I think I would eliminate the worst carbs like sugars, breads, potatoes, pasta, corn, maybe rice. Rice would be the last one I'd eliminate, because it's pretty easy on the gut for most people. So get the gut straightened out, get a CGM, and do all the stuff like Digest Shield, BPC 157, maybe colostrum. You could add that to it. Yeah, you're the kind of patient we really like to work with, because you can get better and you can keep 30 pounds off. You can keep way more off. You just have to do that. I had a great new patient today that came pretty far away to see me, and very interesting case. She was a previously healthy lady who had a heart attack and 3 stents placed this past year, just out of the blue. And, and she's diabetic. And her A1C popped up to 10. And I think that's when she had her heart attack. Really, like I told her, if your A1C is 5.6, you're doing damage to your arteries at 5.6. So get your A1C down. And remember, A1C is just a 3-month average. You really need to look at those spikes too. And the only way you're going to do that is through a CGM. But anyway, so really her main problem is to lose the weight. No doctor had ever told her about Ozempic or Mounjaro. And she was already on metformin, didn't like it. So I switched her to berberine, put her on Mounjaro, and she'll lose 50 pounds, which is what she needs to do to get off all the other medicines she has to be on now for those stents she has, and she has cardiac disease. So she's one that I love to see because we can really help turn that around. And the other thing too, she's very low on her hormones. Nobody's ever mentioned hormones to her. She had no idea that taking hormones could help you keep weight off and help everything else. I mean, all-cause mortality is improved by taking bioidentical hormones. Even after 65, those new studies prove it. So just a really interesting, that's somebody I really love to work with. I know if she follows my directions, which I think she will, we'll be sitting there 6 months, a year from now, and she'll be off a lot of the medications, feeling great. She'll be at her baseline lean weight. It's just very gratifying because she's trying to eat, and she's eating pretty good, but she's not going to be able to lose that kind of weight without something like Mounjaro or Ozempic. It's just about impossible. So now we have a great tool, and people go, I'm scared of that. Really, you should be scared of not being on it, because here's the long-term side effects: way less heart attacks, reversal of fatty liver disease, reversal of chronic renal disease from your diabetes, probably less Alzheimer's, and control of your blood sugar and weight loss. So I really enjoyed talking with her today. A lot of docs just don't have the time or knowledge to do that. I even sent her to Lucas. She's going to get an appointment to Lucas with a food diary. And then we're going to take one step at a time. Then I'll tune her hormones up as we go. But she's just been fed a lot of bad information. She's scared of a lot of things that she shouldn't be.
That is such a great question, and I know that not only helped the listener, but so many others in here tonight. I'm going to put this up here from Rhonda. I saw it from the beginning, and it kind of goes with what you just said. And honestly, Rhonda, I'm wanting to know his thoughts on this as well. What are your thoughts on the recent study that just came out about Ozempic and Mounjaro? Have you read this? They said it can mess up your hormones and should not be taken long term. Do you agree?
I haven't seen that particular study. I'd like to, if you can reference this, I'll look at it. But there's always some kind of study or some statements that come out and say you lose too much muscle, which you can lose muscle with these type of medicines. That's why you need to do some training and you need to up your protein. And we measure the muscle loss through doing the either a DEXA scan or, we'll put you on our machine that's very accurate, the InBody. But yeah, the long-term of side effects, like I said, are less heart disease, reversal of fatty liver, reversal of renal disease. I mean, there's so many. I've even seen it improve migraine headaches. So it's a multi-use medicine, and I haven't seen it mess hormones up in my experience, and that's what we do 90% of the time is weight loss through treating metabolic syndrome and hormone replacement. But when you say mess up your hormones, who knows what that means? I mean, it can cause GI upset. There's some people that have had a history of pancreatitis or MEN syndrome, number 2, medullary thyroid cancer, which is rare as hen's teeth. Shouldn't take it, but you always have to measure the benefits versus the risk with anything you take. And people say that hasn't been out long enough. Well, that GLP-1 agonist has been out for 10 years, and most of the studies are very positive. And I think you should take it long term, because when you lose the weight with it and get off of it, your weight comes back 90% of the time. Meaning it's not a matter of willpower. It's a metabolic problem with those gut hormones. So again, you can find any study that will contraindicate another study. Any study out there, you can, if you're looking for something, you could go find it. You can make it up. I mean, look what happened these past few years with all these studies that have been made up, and the numbers, just totally made up. So
Sure.
basically, I look at what happens to people, how they feel, and follow them long term. I mean, I'm not saying if somebody loses, 100 pounds and they get off everything, that they may not be able to wean way down or maybe possibly get off of it. But my strategy is to get them to the weight they're lean and they like, usually like a high school weight. And then maybe keep them on the lowest dose that I can that will benefit them in keeping that weight off. Remember, they call Alzheimer's type 3 diabetes. So there's a lot of individual things you got to, the risk versus the benefit. And right now, in my mind, for most of the people I treat, the benefits far outweigh the risk or side effects. But talk to your doctor.
Rhonda, I hope that helped. That's such a great question. And one thing I encourage everyone in here to do, if you see an article come out that is contradictory to what you once believed, or maybe it's something that affirms what you believe, put it up. We love to talk about that stuff. And one thing, Doc, that you put so well that I hadn't heard you say before is you really can find a study that contradicts another study if you're really looking for it. So it is so unique and so personalized. So I hope that helps, Rhonda. Thank you so much. I see some people coming in on Instagram. Thank you guys so much. Candace, I see you. Amanda, we're so proud of you. I love you. Raleigh, I love you. I'm going to see you here soon. Restorative Functional Medicine. We love you guys. Thank y'all for hanging out tonight. If you guys have a question on Instagram, go ahead and put in the comments. We're going to get to every single one of those as well. I'm going to put this up. Oh, that's awesome, Teresa. Thank you so much. He's the best. I want to know if he played any music for you. Sometimes he'll do that. Sometimes he'll
be sing for you.
He might sing for you. He's the best. He's the best, Teresa. Thank you so much. This question came in over email, and I loved it because I want this to be a place we can talk about the money side of it, because we're super empathetic around the cash part of this, and especially around hormones. It can get super expensive. So this is a question around hormones. A friend of mine sees a menopause specialist via telehealth, and she is paying a fraction of what I pay for unpredictable, inconsistent compounds at local pharmacies. For me, compounded progesterone is $100 and compounded estradiol is $36. Her same meds are $10 for progesterone pills and estradiol is $6 per tube. They are both supported by insurance. Is it possible to go this route via PM to make HRT, hormone therapy, more financially accessible for those of us on lower incomes? I love this question, and I'm very grateful for the question. And I know this is going to help a ton of people. What's your thoughts on this? I know.
Yeah, certainly. That's when I look at that, I go, wow, you're paying $100 for compounded progesterone. That's unbelievable. You should shop around for one thing. I do like local pharmacies. Again, I know most of them and I trust them. Again, sometimes there could be some variance, and certainly with prices, there is variance around. But, as far as I'm concerned, shop around. I don't care where you get it as long as it's an accredited compounding pharmacy. And that just seems unreasonable that you're having to pay that much. One thing you can do for people that are on a budget, you can combine the progesterone in a cream and put estradiol and testosterone in there and DHEA. I've seen it sold for, $30 to $40 a month. So, those prices, $10 for progesterone and $6 for an estradiol tube, you need to ask where it's coming from. Is it coming from China or India? It's crazy. The sourcing of it sometimes is a little bit worrisome. We do telemedicine for suggestions for people a lot, but sometimes I just don't know if you can trust where they're sourcing the hormones from. Certainly, I'm not against it. I want you to shop around and get the best price you can. But look at the labs. You do get on those. Look at the labs, and either blood or salivary. And you certainly can come to us. Again, we don't sell these hormones. We write prescriptions for them, and you should get them at the place you trust the most and that you get the best deal for. But get the labs and see how you feel. I go really more about how it's helping you than what the absolute labs look like. But certainly we do look at those estrogen to progesterone ratios and also the testosterone level. And so that's really interesting that you can get it that cheap. It just makes you wonder, maybe do a little more background check on, where, anybody can call themselves a menopausal specialist, I guess. So just do a little more digging into it and make sure it's legit and where they're sourcing their hormones from.
So the key thing to look for here is it accredited and where are they sourcing the hormones from?
Yeah,
I'm assuming these are bioidentical. Yeah.
Is it from the U.S. and is it an accredited pharmacy and that complies with all the regulations? So it just seems kind of wild that the prices would be that cheap, but maybe they do such a tremendous volume that they can circumvent some of the local compounders. But interesting. Yeah, keep us informed on that. I'm really interested to see where that comes from and how legit it is. But shop around too. Again, when you combine them all in a cream, it's going to be a lot cheaper than doing it separately.
And also, if there's anyone in here live who has had success with where they're getting from and it is more affordable, let us know. We want to this is what this show is for. So hopefully that helps a little bit. We want to keep talking about it, and there's definitely some smart ways to go about this.
That's a great question.
And I honestly, I wish we talked more about ways to go about hormone therapy that is more affordable. There's definitely different routes. We do self-injecting for the men all the time. It's a great way to save money if that works for you. But obviously, some people prefer the pellets, which can be a little bit more pricey up front.
Our creams, creams are probably the cheapest way to go. But
it's a great question.
Don't like them, don't absorb them well. But get your levels checked and keep us posted on that. Very interesting.
All right, we're going to keep moving here. I'm going to go to a zinc question. Is 50 milligrams of zinc per day too much? My multi plus happy healthy hair equals 50 milligrams. So just wanted to make sure.
That's really about the perfect dose. When
I was taking zinc plus the super, and that got me to 80. And because I think the super it has 30 in it. And I backed off the zinc, and I'm just taking the super. But I've heard you say 50 is fine.
50 is optimal. You can go up to 100. When you get sick, you should pop it up to 100. Just don't go over 100. And remember, because when you get to the higher doses of zinc, they can make you nauseated, take it with food, but also it can deplete your copper. So that's why I put copper in the super, as well as boron and manganese. Had a great tip on manganese this past week at the conference. It may be very helpful for treating Ehlers-Danlos syndrome, which I really need to do a podcast on. But manganese is another important one for your bones. Ehlers-Danlos syndrome is a fairly common. It's usually not even recognized, but it's a connective tissue disease where people are really, really, their joints and their tendons and ligaments are really hyper flexible, and so they get hurt all the time. They're always rupturing or something, or getting hurt all the time. But manganese may be one thing that you can do for that. So previously, there's not a lot you can do. Collagen's another thing I tell people to get on. But it's a great question. 50's fine. 50's perfect.
All right. Thank you for that question. Nikki on Instagram, I see you. Thank you so much for being with us tonight. Guys, if you guys got a question for Dr. Rogers, we're going to go to the live portion of the show here shortly. We got one more question here that came in throughout the week. Thank you in advance to everyone who does that. In January, I had some very small spider veins injected by one of the best vein surgeons where I live, so a legit place. I really think they are worse now. Is there a potential outcome with very small veins? I love this question. I know how much you love spider veins, just knowing you.
Yeah, I've done a lot of work with veins in the past. And, when you inject spider veins, they can go away. Then veins have a way of rerouting, and sometimes they can come back worse. One reason when I do veins, I use a vein light so I can see the feeder veins. So if you're just injecting the spider veins and don't get the feeder veins, what we call reticular vein, then they're going to come right back, and maybe worse because they come in clusters. So, make sure they're getting the feeder veins. You should probably also get a Doppler study, to make sure you don't have a lot of venous reflux. I sent somebody today to the vein company. They do a great job with all the things. I had a patient last week. This was a really interesting patient where she had obvious venous insufficiency with a lot of swelling at the end of the day, but her one foot was swollen most of the time. I mean, it would go down a little bit, but it was her left foot and ankle were way worse than on the right. And I examined her, she had very few spider veins, no varicose veins. But what they found this at the vein company, that she had a compressed iliac vein, which is in the abdomen. And I talked to some of the vein people about it. It's not too uncommon. So if you have a unilateral swelling in one of the legs, it may not be lymphedema. It may be a compressed iliac vein in your abdomen, and they can go up and stent it. But it takes a venous contrast study to figure that out. But that could certainly happen. I've seen it happen. Usually you've got some reflux, and they may not have gotten the deeper ones and shut them down. Because if you don't shut the deeper ones down, the spider veins, which are really cosmetic, but a sign of something deeper, they're going to come back. And I have a laser. I used to laser them off, and I just haven't gotten great treatment from laser. I'd rather inject them with, and I use polydocanol. I don't like to use saline. It's too painful, and if you get it in the skin, it burns the skin. So But the vein company is a great place for you to go if you live anywhere in East Tennessee, Southwest Virginia.
That's a great question. Thank you so much. We haven't gotten to talk about spider veins in a minute, so that was a lot of fun to hear. All right, guys, we're going to the live portion of the show. If you guys got questions for Dr. Rogers, I see him coming in. Lawrence, I see you. Teresa, great comment there. Thank you around the specialty pharmacy out of New Jersey. Walking Moments, Lynn K, I got you. All right, guys, if y'all got a question, I see you, Yoga Mama, on Instagram. We're going to get to that in just a second. Let's see here. Vinny, I see you. All right, let's keep going here. If you guys got a question for Doc, we're going to get to every single one tonight. Let's go to Frida. It's been here since the beginning. Thank you, Frida. I had swelling in my feet joints, in my feet joints and my toes, side of my feet, all around, and the bottom sore, knee sore. My CRP was 33.9 and RA was 13. Not told much to steroid pack, which helped. Your thoughts? And I hope I didn't mess that up, Frida. If I did, I'll reread that. I apologize. What's your thoughts on this? And then it moved around and was in joint of finger and elbows as well.
Izzy's barking. Yeah, that's an interesting case. That's a high CRP. And, one thing about migratory arthritis, you better look for a cause of it because it may be Lyme disease. When I see somebody that really has a lot of pain in the bottoms of their feet, you better think Bartonella, which is another tick-borne illness. So, which is sometimes hard to diagnose. It'd be really interesting, to run the test on you and see. There's a pretty accurate IGX test that you can get to a specialty lab that looks at all the major tick-borne diseases. Ticks are, you think about Lyme as being Borrelia burgdorferi, but there's also 9 other types of Borrelia, Lyme. Then there's also Babesia, which is a parasite, tick-borne. A lot of times you'll get both from the same tick. And then you have the worst one called Bartonella, which some people used to call it cat scratch fever, which it can be, but it's caused by a tick as well. And Bartonella, when you have pain on the bottom of your feet, Bartonella, so look for infection, and if you can't get a hold of those specialty testing, just get whatever Lyme test you can get. And here's something I do occasionally with a patient like that comes into my office. If they don't want to do a deep dive, or if they don't want to poke the skunk, what I call it, then they may want to just get their doctor to put them on a month's worth of doxycycline to see if they get better. Because a lot of this arthritis is infectious in etiology. I really feel pretty strongly about that. It's really interesting. Dr. Horowitz up in New York is very famous for writing the book on Lyme and all these other tick-borne illnesses. As a matter of fact, he wrote a song along with John Oates of Hall & Oates about ticks. He must have treated him for it or something. I don't know, but he has a song on YouTube, Dr. Horowitz song on YouTube about ticks and Lyme. So that's something you can't ignore. I mean,
yeah.
That's a really bad problem that of course you can take a steroid dose pack and feel better, but you know what the heck it is, what's causing it. So do a deeper dive. And your rheumatologist is probably not going to take a deeper dive. That's the sad part about it. You'd have to go to an infectious disease person that really is an expert on Lyme and tick-borne illnesses. So it's really interesting.
Is there a book you can recommend? Is there a book?
Yeah, look at Dr. Horowitz's book.
Okay.
Horowitz out of New York. Dr. Horowitz.
Frida, I hope that helps. Thank you for that question. I see Coal Miner's Daughter's in here. Coal Miner's Daughter, welcome in. And what's funny is whenever I hear Hall & Oates, I can't help but think of our friend Tony Basilio, and it makes me think we got the Vols baseball team in the World Series. So I've been listening to quite a bit of Tony. We got any Tony fans in here tonight? I hope so. We're fans. Okay, let's get to Yoga Mama Shelly over on Instagram. As you guys know, I can't pull this over, so I'm just going to do this audibly. So forgive me in advance. Yoga Mama Shelly says, why is going to a naturopath so expensive for an initial evaluation? I just took my daughter who's having major gut issues. The GI map was 300. The initial eval was 695. We haven't done labs yet. I'm in California. It just really sucks. I want to go natural, but it's so expensive. Man,
Yeah.
that is expensive.
Here's the problem. You're living in California. You're living in the Golden State. But yeah, it's expensive. I didn't know it was that expensive to see a naturopath. I don't know, it's crazy how the world of medicine is. I mean, I kind of consider myself a blend of traditional and alternative, whatever you want to call it, holistic, functional, integrative. Somebody that knows about both worlds. The best of both worlds is what you need. So you need to get somebody. Why don't you just go to an integrated medical doctor, functional medical doctor? Get somebody that's board certified in integrated medicine, and check the credentials out and see if you can't get better pricing and that type of thing. But I like the naturopaths, have
I do
friends,
too. Yeah. They're amazing. And I mean, I know it's worth it. Also look into telehealth options. But with integrated medicine, look, we like A4M. So we always, when we recommend other people, we look for someone who's been, trained through the American Academy of Anti-Aging. So those are some things to look out for, Yoga Mama. Thank you so much for being here, and I hope you can find somebody that's maybe more affordable. But you're doing the right things, it seems. So that's the plus of this. All right, let's go to Courtney here on YouTube. Can I take Gymnema for weight loss? I do not have diabetes, Doc. Can you tell us what Gymnema is?
I don't use much of that. That is a prescription medicine. In some states, you have to have a prescription for it, but it's one of those insulin resistance drugs. I just don't have enough experience using it to tell you how it works. Again, I really like I like Ozempic and Mounjaro a lot. And if you want to just go totally natural, what they call nature's Ozempic, try berberine, the dihydroberberine. I think it works pretty well. Just a lot of it depends on how much weight you have to lose. If you have a significant amount of it, then you might want to go with Ozempic or Mounjaro. Same thing, Wegovy, Zepbound. So, but I'll give a little more thought to that. Maybe we'll revisit that next week, Ben, and see if I can find anybody who's been having a lot of success with it.
One thing, Courtney, I'd suggest too, if you're wanting to learn more about it, we did an Explain This episode with Robin Riddle on Gymnema in particular. It's a relatively short video. Robin does a great job of describing kind of
she did that, yeah,
where it comes from, what it works for. So definitely check that out. If I remember correctly, it kind of blew my mind when we were talking about it, because there's a lot of cool things around Gymnema. So thank you, Courtney, for bringing that up. If you look up Gymnema and Robin Riddle, that video will definitely come up on YouTube. Yeah. All right, let's keep it moving here. Brandon on Facebook, I had a bad sinus infection or COVID and lost my taste and smell, but haven't got my taste or smell all the way back. Do you have any recommendations for this?
Yeah.
This is about 3 weeks ago.
You just got it about 3 weeks ago. Okay. If you're over I don't know what kind of treatment you had for it, but and if it was a sinus infection or if it was COVID, because you treat them a little bit differently. But, if you lost taste and smell, it might have been COVID. I don't know if you've had previous COVID or, the status of what you took for it. There are great treatments for it. I'm betting you took an antibiotic. But yeah, it's things that I think have helped that because we dealt with a lot of that during, COVID on the first go around. Zinc, I think, helps. The other thing I think helps pretty good is a nicotine patch. I think those are the two top things that I've used with success. But make sure your sinus infection's gone, and if it is COVID, we hit it with some other things as well that work pretty well that we can't mention a whole lot about, on this show. But hopefully you're going to get your taste and smell back. But try that zinc and maybe a nicotine patch.
Brandon, I hope that helps. Thank you for being with us tonight, and I hope you start to feel better. Let's get to let's see here. Lynn K. Let's get to Walking Moments. Are non-organic USA cows and pigs all mRNA injected GMO now? I don't know if I'm reading that right. Am I reading that right?
Yeah, you're reading it right. I don't know. It wouldn't surprise me. So if you're a beef eater, which I am, get grass fed, non-hormonal. You have to kind of know what you're getting. I like to get mine down at the local farmer's market, or there is a butcher that actually is fairly near where we live that does all the good stuff. So yeah, I don't know. That's the rumor.
Thank you, Walking Moments. Let's get to Lynn K. Lynn, getting iron infusions. Anything to help absorb it? I am gluten-free.
Yeah, well, if you're getting iron infusions, it's getting in there, which is the best way to treat low iron if it's really low, because it's fast. And, I like vitamin C as well. You should be taking some oral vitamin C. 1 gram twice a day is what I would give. But definitely vitamin C enhances iron absorption. But I'm glad you're gluten-free.
Thank you, Lynn K. Shelly, Yoga Mama, we love you back. Thank you so much.
Beef liver, grass-fed beef liver is
beef
pretty
liver.
good for iron too, yeah. But take vitamin C as well.
All right. Lawrence is saying, taking testosterone, can it cause enlarged prostate? This is a common question we get, Lawrence. What's your thoughts on this, Doc?
Not supposed to. Occasionally I'll get a guy that says they thought it might have affected a little bit, but actually, if you look at the literature, and guys, of course, I've seen thousands and thousands of low T men over the years, and it should not cause BPH. It should not enlarge your prostate. If you do get those symptoms after you start testosterone, what you need to look at is your estradiol level, because estradiol can cause that. Again, there's a lot of myths about testosterone. It does not cause prostate enlargement or prostate cancer done correctly when you're looking at the other parameters. And also, I had a case of this today. It does not cause heart disease. This cardiologist had taken my patient off of testosterone because he had AFib. And he said that testosterone causes your AFib. It does not cause arrhythmias. It does not cause heart attacks. It helps prevent them. But again, you have to know what you're doing. It can pop your hematocrit up. You got to watch that. Got to watch your estradiol levels. So it should not, if you do it right, it should not cause an enlarged prostate. We all, as we get older, we get an enlarged prostates. It's part of being an older man. Believe me, I know about it. So there's stuff you can do, with natural medicines, and sometimes I use prescription medicines for it as well. Believe me, I'm an expert on large prostates. I can tell you from personal experience, but no, it should not cause it if done right. Look at your estrogen levels.
Lawrence, thank you so much for that, man. Great question. Dave on Facebook, what happens to testosterone cream after its expiration date? It seems that there's, there we go, follow-up. Does it just degrade in potency, or can it become toxic?
That's a great question.
Yeah.
Number one, the expiration dates, you can go way past it, in my opinion. It's my opinion, but
his opinion.
when they have to put a date on it, I would not be scared to take any vitamin. There's very few creams or vitamins I wouldn't take, way past the expiration date, years. And no, it does not become toxic. It may become 1% less potent. So, that's my opinion. I don't worry about it too much.
Dave, thank you so much. It's so good to see you. I'm going to put this up here because we might have a new hashtag here, guys. Hashtag Doc Rogers. I love
Shout
this,
out.
Melanie. I love this.
Thank you for that. Thank you, Melanie. I appreciate that. I
Thank
wish
you,
I
Melanie.
was the best, but that's
you know
nice of
what?
you to say.
You're the best in my eyes. You're the best in
Ben
my
thinks
eyes.
I'm the best, but I'm his dad.
All right, let's see here. Let's get to Angie. Angie's so good to be here. Thank you so much for being with us tonight, as always. Is berberine good for patients that are on
Yes.
that are insulin resistant?
Yeah, that's the patient I love to use it on.
Yeah.
I think it works great for that. Again, I did kind of a twin study. I think I talked about it last week.
Yeah.
With Kate Carter, identical twin study. They don't need berberine because they're not insulin resistant. They eat mostly carnivore, but it actually dropped them because they did the CGMs, and it really dropped them low. Berberine works for high blood sugar. There's no doubt in my mind it works. So yeah, it's a perfect natural way to do it with very few. I rarely see a person that can't take it. I've had a couple that got a little bit of stomach upset with it. That's rare. But remember, get the dihydroberberine with that. It's the best form of it.
Angie, thank you so much for that question there. Let's get to coal miner's daughter. Why would a toenail stop growing several months out of the year? Is that a sign of something more serious? That's interesting.
Man, I guess toenails are like hair. They grow in cycles. Wow, I wish Brittany was on here. Brittany is one of our newest PAs. She's not a new PA. She worked 8 years in podiatry in Knoxville. She's our foot and toe expert. So that's a great question. Ben, why don't you put that down to ask Brittany, and we'll have an answer for you next week on that, because that's a great question. I'm afraid to say anything because I don't know if it's just one toenail. Sometimes I do, if you have damaged a toenail, like had somebody step on it or had an ingrown toenail, you can really damage some of it. You can see by the ridges and the irregular growth patterns of it. You can even develop fungal nails from an injured toenail. So yeah, that's an interesting question. If it's just on one toenail, why that is not growing? My gut feeling is you've damaged the nail bed somehow. Be interesting to see if you've injured it, or there's nothing else really makes sense unless if you can feel a cyst underneath your nail bed or something, or if you've had an infection underneath there. But that's a really interesting question. My gut feeling is, don't lose sleep over this. It's probably going to be nothing terrible, but it seems to happen if I have a sickness. That is really interesting. I just wonder if you damaged that nail at some point in your lifetime. We'll ask Brittany. Well, Ben, write that down so we can definitely get on here next week and have a more expert opinion for you.
Coal miner's daughter, I have written that down. We're going to get back to that next week. Thank you so much for that question. And Brittany's the perfect person to answer that. We'll consult with her this week. Barbie over on Facebook, is there anything new in sleep therapy? Magnesium, L-theanine. It's a great question. It feels like, there was a Sleepy Girl cocktails out there for over on TikTok for a minute. I was even a Sleepy Girl cocktail guy.
Really? You took Sleepy Girl cocktail?
I sure did. I did the tart cherry juice. I did magnesium in there. Mixed it with a little bit of LaCroix. It was awesome.
You mixed it with water? LaCroix water?
Sparkling water. Yeah, it was awesome.
That's interesting. Sleep's a universal problem. for most of my patients, me, everybody. Magnesium, I love magnesium at night. I always take it at night. I like for sleep, I like the glycinate, L-threonate, and maybe malate. I have one that has a combination of those. L-theanine is a good one. It's part of those, those adrenal adaptogens, L-theanine, ashwagandha, rhodiola, saffron. For me, L-theanine didn't help me sleep for some reason. It didn't help me. But certainly melatonin, everybody tries that. And melatonin has some other advantages, and besides sleep, it's actually pretty good for a lot of things. Maybe anti-cancer. But CBD is a good thing. We do have a good CBD sleep formula that we have in the office, that we private label. One thing I'm starting to do is do sleep studies on a lot of people. I think I ordered 3 today. I wear this Aura ring, which I love. I talk about it all the time. Ben wears it. It's just awesome. It'll give you a clue as to whether you're desatting again. Ben, yours is an old one. Yours in the Gen 3, so yours doesn't measure oxygen values at night. But mine gave me the hint that you probably have sleep apnea. And sure enough, I got a home sleep test, and I have it. So I'm not the typical sleep apnea patient, but I've been on CPAP for a couple of months, just nasal, and man, I'll tell you, it is awesome. So if you snore or you don't feel when you wake up, you're refreshed, think about getting a sleep study and at least get an Aura ring or a Whoop band to really see how much sleep you are getting. You may not know because they tell you the sleep latency, how much deep, how much REM, how much light, how much movement you've had. I mean, they're just amazing. What your body temperature is at night. So those are most of the new things. I mean, there's some prescription medicines out that are fairly new, like Dayvigo, and that really are more like, they're not really sleeping pills, they're more like daytime alertness pills. Sometimes I see people that can't sleep and they actually have ADD. So you treat them with stimulants in the morning, they sleep better at night, but that's, I don't know if you have ADD. But a lot of times I'll have a patient that comes in for something else and I'll start talking to them for a while. I think, do you think you may have ADD? And I give them the quiz, and sure enough, it causes a lot of their problems, whether it be sleep problems, depression, anxiety. I see a lot of adult ADD out there, especially in the world when you have all this multitasking everybody has to do. But so look at those things, we just
That's a great question. Barbie, I hope that helps a little bit. This is kind of right along the lines with what Barbie was asking on Facebook. Max is asking, I keep waking up around 3 a.m. and can't go back to sleep. Started magnesium pills, sleep well until about 3 and then wake up. What should I do to get 7 to 8 hours of sleep every day? Max, this seems to be the goal of everybody. It's harder.
That's very common. It's really more common that I see that people can go to sleep, but they wake up too early. Look at your lifestyle. Exercise, hard exercise during the day, not before you go to bed, is really good. Avoiding a lot of light and sounds. Keep a cool, dark room. There was a new study that came out a few weeks ago that said some people sleep better when they read a book at night. Maybe the light doesn't bother some people. Maybe it helps them. I've always said don't watch TV at night as you go to sleep, but this study said for some people, it actually helps them.
That's interesting.
I know some people that watch the same TV show, a comforting, Tommy Andy Griffith or something like that. And it actually, if you're watching a lot of stimulating TV before you go to bed, it's really bad for you. But something that you've seen a million times that comforts you, relaxes you. Some people just get a little anxious. The waking up, your sleep cycle is kind of screwed up. You might increase your dose of melatonin. And also, when you take melatonin, don't get the short acting, get the long acting melatonin, at least the intermediate release, so that, that's the common complaint about melatonin. It helps me sleep, but then I'll wake up. Either you're not taking a high enough dose of it or you're getting the short acting version of it. So I like CBD too. I love the CBD for sleep. You take both at the same time.
Max, thank you so much, man. Walking Moments, best herb or supplement to raise testosterone levels in men? I love this question. One, because lots of people want to raise their testosterone levels naturally. What's your thoughts on this?
Yeah. Life Extension has a couple boosters. Forskolin, I think, is one of them. Gosh, I'm blanking out on the other one. But there's a lot of supplements that, like Tonkat Ali is probably my favorite one. Maca is another one. Certainly zinc is
Zinc. I was thinking zinc.
Zinc is good for that. Those are probably my favorites. There's a lot of formulas that they claim to help it. You see advertisements for them all the time, and I have some guys that say they help them. Don't be afraid of real testosterone either. It's going to work way better. Men or women.
Yeah. Walking Moments, thank you so much, guys.
Women DHEA is pretty good for also popping up your T level a bit. I don't find
DHEA.
it helps so much in men. If you're a woman, don't get over 15 milligram of DHEA. You start having hair loss, but it's really one of those adrenal hormones that really may pop up your T a little bit. So,
guys, how'd we do? Let us know. 1 to 10. Did we get a 10 tonight? I give Doc a 10 because, one, I thought you were incredible. That was incredible. Real quick, I'm going to put this up here, guys. The Dr. Rogers vitamins are available on performancemedicine.net/shop. That's the QR code there. I'm going to make this discount code live tonight. If you guys are interested or want to get vitamins, if not, no big deal. Live Q10, it'll be activated for the next 48 hours. I like to do this for the people who are with us live. 10% discount live Q10 on our website, performancemedicine.net/shop. There's the QR code right there. And I'm going to try to get rid of this so I can see you guys. And then we're going to call it a show.
Ben, can you get those gummies online as well?
We're going to get those on. We have a new website coming out here in the next month. 4 weeks, we'll have a revamped store. The CBD will be up there as well. We're super excited about that. Like we said earlier, this is what's in the super. It's a whole bunch of stuff. And I put this up here just for me. This is the immune complex. I also take this one. But yes, the CBD will be up. For those who are in the Tri-Cities area, I want to put this up for my man Josh. They are doing a deadlift clinic Thursday, June 27th, 5 to 7 p.m. You might see these flyers in our Johnson City office. You can sign up at that QR code, or you can shoot me an email, and I'll make sure he gets it from TriStar. So the deadlift clinic is Thursday, June 27th, 5 to 7 p.m. at their new location. Huge shout out to TriStar Strength and Rehab. Doc, what do you think, man? We did okay?
Yeah, we did good. I think I'll go ride my bike, Ben. Thank you.
Steve gives us a 10. I love you, Steve.
Sick.
Thank you so much. Too kind. Connie gives us 2 10s. That's incredible. Stan, Tom, thank you, guys. Y'all are the best. D-Lynn, I love you. Thank you so much. 10.5. Pop, go get you a bike ride in. Live Q10, the discount code for 10% off of our vitamin shop. It'll be live here in about 2 minutes. We love you guys. We will be back on the show Tuesday, 7 p.m. to answer your health and wellness questions. There is the QR code there. Thank you, team. All right, we're going to call it an evening. Brad with my outro, man. Come on, Brad. Come in.
Don't go.